Downhill discomfort. 5 key causes of knee pain going downstairs. If you're having more problems going downstairs or on a downhill slope versus walking on flat land, there are probably 5 most common reasons. We're going to talk about those and what you can do about it. By far, the most common reason for having pain going downstairs or walking downhill is having a runner's knee or jumper's knee. This is called patellofemoral pain syndrome, or PFPS. It happens because the patellar tendon, this right here, is inflamed. And that's typically due to overuse. You've started an exercise program and you're doing a little bit too much. You may have excess pressure on your knees. Every pound of body weight is amplified times 7 when you're putting pressure on the knee. So if you weigh 100 pounds, it's like 700 pounds of pressure on your knee with those movements, particularly going downstairs. It loads that knee. So we can talk about reducing the inflammation of the patellar tendon, making sure we've got good tracking, good alignment, and we can start slower when we're introducing exercise, or we can pull back, get some rest, reduce the number of miles you're running, or reduce the amount of time you are exercising. Get back onto an anti-inflammatory eating program, because this is an inflammatory process. Reduce processed foods, reduce sugars, reduce alcohol, making sure that we've got strong muscles that are stabilizing the knee and the kneecap. So we want to make sure we have adequate protein intake, about 1.2 to 1.5 grams per kilo of protein per day to maintain our muscle mass, even higher if we're in a building phase or in an anabolic phase. So that's number 1. Number 2 is having chondromalacia patella. That is wear and tear on this undersurface of the kneecap. And it's basically a fancy term for an arthritis on the undersurface of the kneecap. It typically doesn't happen overnight. It's from chronic malalignment. Say you've got knock knees or bowed legs, then you're putting tracking where this patella is not going up, down in this nice little groove, but rather it's going off to one side or the other. It's going to wear off this side. It's going to wear off this side. And instead of having this nice smooth connection that's wearing, you get almost these little jagged areas, like when you learn to sew and there were some snaps and the snap goes in here and it connects. So that can cause a lot of pain, typically right under the kneecap, or right in this area just below the kneecap. It could be off to one side or the other if you've got a maltracking problem. So that would entail doing some exercising where you've got the knee in a good tracking. We often use KT taping for this. We can use physical therapy to rebalance the muscles. Sometimes people need orthotics because it can happen from having flat feet. Inserts, changing out the insides of your shoes, like when you change your tires, because think of your shoes like your tires. You can only put so many miles on them. So that's important. The third most common reason for having pain going downstairs is you can have a meniscus tear. A medial or lateral meniscus. Remember, the menisci are these cushioning things here. This one is lateral, this one is medial. And if I took away that cushion, then we'd be with a blue surface coming into contact with a blue surface. In this knee model, the blue surface is cartilage. So if we've got a tear here or here, then we're going to have blue coming into contact with blue. That can cause pain as you're weighted and going down those stairs. Because remember, we talked about a 7-fold increase in the amount of pressure when you're weighted and going down the stairs. The fourth most common reason for having pain going down the stairs is osteoarthritis. Simple wear and tear of the knee joint or the cartilage. So we start to get a decreased amount of space within the joint. This is no osteoarthritis, and we could potentially have a reduction of all this blue, so it's a bone-on-bone grade 4 osteoarthritis. So decreasing the amount of knee pain going downstairs or on a downhill slope when you have osteoarthritis are to make sure that you've got a warm joint. So you do a warm up before you do the stairs. You decrease the amount of inflammation in your whole body, making sure that there's that nice anti-inflammatory eating, that you are decreasing the amount of inflammation in your life. Sometimes wearing proper knee braces can help because it keeps the joint warm. Some of the braces, like the Incrediwear, cause warmth to the joint. Getting into the shower or putting on a warming rub, topicals, before you do your exercises going down the stairs or climbing stair descending or walking on a downhill slope. So if you're going to hike and there's ups and downs and ups and downs, what's causing the downhill knee pain could just be arthritis. So maintaining a healthy body weight, etc. The fifth most common would be that you actually have an injury to your quads. The quads are going to be responsible for kind of stopping that momentum force as you're going down. If you've got a tear or microfracture in your quads, then you can have some pain going downstairs. You'd probably notice that you had an injury. There might have been a blow to the quads. There might have been a certain time where you felt a pop, a tear, a pull. Then that's going to happen with causing some pain going down the stairs. Actually, let's make it 6. The sixth most common reason is that you can actually have an inflammation of the bursa called the pes answering bursa. So that would be where the hamstring tendons are attaching here on the anterior portion, a couple centimeters beneath the kneecap, and they can get inflamed, bursitis, and that can be from having tight hamstrings, a hamstring injury, kind of a friction of wear and tear on those hamstring tendons as they attach in on the bursa. So that would be pulling back from the activity, maybe icing the area, making sure that your hamstrings are healthy, that they're stretched, that they're warmed up before you do these activities, such as going down the stairs. And once you have started to get some tightness, to stop, take a break, and stretch the hamstrings. We have another video on specific hamstring stretches. So those are the most common reasons that people have some hamstring, quadricep, meniscus, osteoarthritis, the chondromalacia patella, or the patellofemoral pain syndrome. So we threw in a bonus for those of you who waited to the end. I'd also love it if you subscribe to the channel. You can leave some questions or some comments in the section below, and I will answer them for you. It's been great teaching you about pain with going downstairs or downhill. Please see us next time. Thank you. If you have knee pain and would like to learn more, I have a worksheet called 5 Things to Do Now to Reduce Your Knee Pain Within a Week. Go to www.kneeboostnow.com to download it for free. I'd love to hear from you, so please like, subscribe, and comment below so I can help you get out of your knee pain.